Wonderful. Thank you so much. Um, I'm Sandy Reader, and I'm the lead for Qualitative Implementation Research at the Monash Centre for Health and Research Implementation at Monash University in Australia. I'm a female, I've got short brown hair, pale skin, blue eyes, and I'm wearing a black coloured top this morning. And I'm here with my wonderful colleague, Ashley, whom I'll get to introduce herself as well.
Thanks, Andy. So, hi everyone, my name is Ashley. I am a dietitian by background and have lived experience with diabetes, and also, a researcher in consumer and community involvement, which I know you guys are more familiar with patient and public involvement. I have long brown hair and I'm an Asian ethnicity by background, and I've got a green blazer with a black top on today. So I'm looking forward to sharing this presentation with Sandy today with you.
Thanks, Ashley. So you can see the title of our presentation there is Innovative Digital Solutions for Consumer Engagement and Health Research and Improvement. And to talk about this, I need to give you a little bit of background and tell you about what we call the CSIRI project, which underpinned this digital solution. And CSIRI stands for Consumer and Community Involvement, as Ashley said, that's what we call it in Australia, Implementation Research for Impact. Okay, I also need to tell you a little bit about some Australian context, which sits behind the CSIRI project, which is about the Australian Health Research Alliance, or AHRE as we call them. So AHRE facilitates the integration of healthcare, health and medical research and health professional education with the aim of delivering better health outcomes for all Australians. Across Australia, there are 14 research translation centres, and AHRE is the single voice for all of these centres with the hope to deliver better health through research. They're all funded by the National Health and Medical Research Council, or the NHMRC, as you might know them, in Australia, and they're Australia's largest funder for health research. AHRE's priorities, as you can see listed on our slides there, are to systematic embedding of research into Australian healthcare, the better alignment of research capacity with clinical priorities, and better and faster research translation to deliver patient and public economic benefits. All right, moving forward, a little bit delayed. So some background to embedding consumer and community involvement into health systems is that in 2018, AHRE made a commitment to embed, sorry, I think I've gone one slide too far forward here. Yep, there we go. In 2018, AHRE made a commitment to embed consumer and community involvement in health and medical research policy and practice, and it was to do that, it was one of 4 national level initiatives identified. They established the AHRE Consumer and Community Involvement Committee, and they also established a formal alliance with the Consumer Health Forum of Australia. And the Consumer Health Forum, of Australia is the national peak body that works to achieve safe, quality, timely healthcare and improve understanding of the health systems for all Australians, and they attempt to represent the interests of all Australian healthcare consumers. So this initiative involved undertaking a national survey across all AHRE members to understand consumer and community involvement attitudes, practices, resources, and an environmental scan to understand the landscape across 4 jurisdictions was also undertaken. These results were analysed and then represented back to our group in a shared national workshop. And from that point, the sort of second phase of this process commenced, and 4 key recommendations for embedding consumer and community involvement into research policy and practice across Australia were identified. I'll just tell you a little bit about those 4 priorities. So the first recommendation involved the development of evidence-based practice models for consumer and community involvement, and this resulted in the development of a practical handbook which was to guide stakeholders and organisations in embedding consumer and community involvement. The second recommendation was to establish a knowledge hub to be a central point of information for consumer and community involvement and for knowledge sharing. And the CSIRI project that I introduced earlier has in fact established this digital knowledge hub, and Ashley will talk further about that in this presentation. The hub brings ideas, knowledge and tools, research and all sorts of consumer and community involvement activities together. The third recommendation was to review the efficacy of existing consumer and community involvement tools. This resulted in a report of an evaluation of the current consumer and community involvement evaluation tools that are used. And the fourth recommendation was to establish formal international alliances with international patient and public involvement organisations, and Australia is still working on that one. Moving forward, so as I said, that second recommendation was to develop the knowledge hub. So to understand sort of the lay of the land, we undertook quite extensive national stakeholder engagement to try and understand what a knowledge hub might look like. So we undertook a rapid review, a survey in which we had 201 academics, consumers and clinicians participate in. And we also undertook the co-design workshops across 4 different states in Australia, which included 85 academics, consumers and clinicians. After analysing all of this data, there were 3 sort of key themes that came out of that. One was that people wanted the knowledge hub to be a connection space with others. So they wanted to have the ability to link and connect people, and this was described as a really essential feature of the hub. Another theme looked at access to resources and training around consumer and community involvement, and people wanted fairly high quality, very up-to-date resources, and they wanted curated resources. They didn't just want any consumer and community involvement resources placed on the hub. And for any of you who may have looked for these sort of resources, you would know that they are incredibly varied. They're available, but they're all over the place and often quite deeply buried. And so people wanted them brought to the surface and popped into one place and vetted to be only the most useful and best quality. They also wanted the hub to have a practical focus. It needed to have practical, detailed information about how to actually conduct best practice consumer and community involvement. They also wanted example case studies of consumer and community involvement and links to training, and training not just for researchers, but also for healthcare professionals and consumers. They're also very clear in that third theme that the hub needed to be an accessible and engaging space. So it needed to be accessible, not just, as I said, for researchers and clinicians. It also needed to be accessible for consumers. It needed to be user-friendly then for all, very intuitive to navigate. And it was suggested that the resources needed to be kept very up-to-date, fairly, and that they were also refreshed. So they didn't want people just to engage with the hub once. There was a sense that people should be able to re-engage with the hub as a resource for useful information that people could go back and find in repeated effort. So that's the background to the CSIRI project. And this is a project that brought the Knowledge Hub to life. It was funded by the Medical Research Future Fund, and we had 2 years to do this, which was an incredibly challenging but fabulous project to undertake with Ashley. Overall, the aim of the CSIRI project was to generate new knowledge and to implement evidence-based solutions to embed consumer and community involvement in research to ultimately improve its relevance, translation and health impact. At this point, I'm going to hand over to Ashley to tell you the details about the hub.
Great. Thanks so much, Sandy. And I normally speak at 100 miles an hour, so I'm going to do my best to slow down today to make sure it's all nice and clear. So now we've undertaken that background work on what this hub would look like and what people want from it. Now with this new grant and this new project that we're working on, we needed to make sure that it wasn't just a website development page where we put all of this in place. And so what we have put together is a very robust research methods altogether, underpinned by very strong frameworks. So you can see we've amalgamated a couple of different frameworks in here. So first with the three sort of donuts there in blue, the top left-hand corner, you've got the consolidated framework for implementation research. And from there, we really use those three different layers of who sits in that outer setting, who sits within that inner setting, and the individuals who are our researchers, our clinicians, and people with lived experience or consumers within that individual setting as well. We really use that framework to help drive who the key stakeholders were and to target that whole health systems approach there as well. And then within that, we then also used the Monash Learning Health System model, which is that circular framework on the top right with the 4 quadrants. And so that 4 quadrants in a cyclic manner really promoted an iterative change going throughout the project, but also throughout the life cycle. And so the first quadrant of that is actually looking at evidence from the stakeholders, which we have then mapped out using that consolidated framework for implementation research framework, the CIFA framework. And then the next 2 quadrants, quadrants 2 and 3, which are on the bottom of the circle, uses evidence from data, so existing literature, but also what is currently happening in practice. And so we've done this in a couple of ways. We've done a scoping review on what a network would actually look like to support consumer and community involvement, what it takes to build and sustain that network, and why it's vitally important for that, for embedding consumer involvement. And we've also done a national survey to find out what is currently happening across different environments and how people perceive or understand consumer and community involvement in their own space. We've also done interviews with the different stakeholder groups as well to find out, to have a deeper dive into what is driving change and what is needed to drive that change. From there, the top left quadrant is about implementation. So that's once we've developed a knowledge hub, we would then implement it and see how it has made a change. And then again, that whole cycle of then drawing from the stakeholders to get their feedback and then going in that cycle. So that's how we approach that whole systems level change. And then at the bottom, we've got a really nice circular framework for the RE-AIM, which is an evaluation framework. So it looks at the reach, the efficacy, the adoption, implementation, and maintenance of a particular intervention. So we have integrated those in the implementation quadrant as well. So we've published a paper on this, and I've added that citation on the screen there. So if you'd like to have a look at it and read more in detail in it, please feel free to and come with any questions. And how we have actually embedded consumer involvement within the whole project, because we know that we have to walk the walk and not just talk the talk. We made sure that we had a consumer lead who was part of the chief investigators research team, sitting at the very high level, ensuring that we have who's our first point of contact when it came to anything sort of consumer related, but also getting her first input in before we went broader. So as Sandy mentioned before, this project is done in collaboration with the ARA centres, so the Research Translation Centres, and within there, they've formed a Consumer and Community Involvement Advisory Committee. So this is representative of all different research translation centres across the country. So from there, we were very confident that we had a really good reach in terms of geographical regions and backgrounds and disciplines as well, because within each advisory committee from the Research Translation Centre, we would also have connections to clinicians, researchers, and consumers as well. We also had a representative from the Consumers Health Forum of Australia sit in on the steering committee, and that was really helpful to get a different perspective as well when it came to the broader implementation plan. Within the project, we also developed a Monash Partners Consumer Advisory Panel. So this was a more localised consumer advisory panel, and we aimed to have this group quite diverse. So we had a project officer reach out to different community groups, really going out into the community and asking them to be involved, telling them about our project. And they weren't just involved with this project itself, they were involved and had opportunity to work across different projects, have exposure to different types of research, but also opportunities for capacity building throughout the way as well. So it wasn't just one consumer advisory panel for the one project, it sort of reached out to a couple of different ones. The research itself, I was talking about, we had a national survey, some interviews, and we also did a national iterative co-design workshops and consultations to support the development of the Knowledge Hub. Most importantly, I think we drew from each one of these data sources to develop what we now call the Health Research Hub. And even with the name, that was co-designed over multiple iterations. We threw out lots of different words, different combinations, different surveys to kind of poll people as to like what was the preferred name, what did that make you feel when you hear this name, and so we landed with the Health Research Hub. So across 270 people responding to the survey, across 70 interviews, and across 5 big co-design workshops, the content, the look and feel, and the navigation of the Health Research Hub was done. And all of that really also helped to tweak the key messages around the knowledge, attitudes, and beliefs when it came to consumer and community involvement, and the key messages to include in there as well. So the key outputs from the overall project, apart from the Health Research Hub, which is the last point on the slide there, we had policy feedback. So we led a national consultation on the revision of the Statement of Consumer and Community Involvement in Health and Medical Research in conjunction with the National Health and Medical Research Council, so the overarching public research funding group. So that was a really huge piece of work there. And so we were able to integrate some of those findings with what we had, which is not too dissimilar at all. We also then, and so if you think about that at a policy level, was the outer setting output. And then in that inner setting output, we developed a implementation guide for research organisations. That's where we had the most rich data that we felt we could really develop something quite substantial to support institutions when it came to how do you embed with consumer and community involvement in your institutions to support researchers to get them to do the best work. And then we will continuously link that back to the Health Research Hub as well. And the aim of the hub is really to then guide consumers, researchers, and clinicians around how to do consumer and community involvement, what resources they were, and I'll go ahead and talk about that in a bit more detail as well, so what that hub included. So really it was, as Danny mentioned in the earlier pieces of work, they really wanted it to be a dynamic digital platform that was a one-stop shop when it came to consumer involvement. We made sure there were credible and up-to-date evidence-based resources on there, and they were curated. They weren't just a whole bunch of things just dumped on there. We provided opportunities to connect as well, and it had updates on the latest news and events across the nation around different consumer and community involvement relevant things. And I'm just thinking back to what James was talking about before with his newsletter that was AI generated, something like that would be so helpful to integrate into this piece of work. So I might talk to you a little bit later about that. And yeah, obviously the tailored information there. And so I've included a couple of screenshots from the website of what that looks like. The link to that website is at the bottom there, so healthresearchhub.com, and it's now live, and you can feel free to go in and have a look at it as well. So this is all tailored information specific to the Australian context, because we do recognise that we are slightly behind on the ball with this, and it takes a bit of guidance to sort of move things forward. And thanks, Shoshana, for sharing the link in the chat as well. So this tailored information here, we've also included case studies from different areas of research and backgrounds. So that includes healthcare improvement projects, working with different community groups, different settings, to show researchers how consumer and community involvement can be beautifully integrated into their work and the impact that they can have. We also had very tailored content depending on the different stakeholders. So if we were writing something for consumers, we would change the language and make sure that it was suitable for easy comprehension, but also having information that was tailored for them, such as how do you reach out to organizations, how do you get involved. For researchers, we would do the same thing. We would talk about more specific resources, but also research-specific things such as the ethics around that and the integrity of consumer and community involvement, and having some templates there for developing terms of references, involvement agreements, and expressions of interest, things like that, to really help make that process easier. We had curated resources, as I mentioned, and a lot of these are Australian specific. We have included some key international ones in there as well, to really help give people a starting point when it came to resources for consumer involvement. And then lastly, with an opportunities to connect, this was where we kind of went back and forth a lot on whether we integrated a discussion forum on the website or we reached to a platform that people were already familiar with. So we ended up going to developing a LinkedIn group. So this is an open group that anyone can be part of, to really just talk about consumer and community involvement. So we have just launched this. It's a little bit quiet at the moment, so we would love to have your active involvement in there. We are hoping that this group will be a great starting point for high-level discussions around opportunities that are around and learning points from different experiences as well. And also understanding that not everyone will be on LinkedIn, and that's one of the limitations there. But we wanted to see what kind of conversations would come up from that in that evaluation part of it, and then tailor things down the track from it as well. So it's just the start of the end. We have this hub that's available now, the Health Research Hub, and it feels like it's the start of a new chapter where we're going through that whole process of the learning health systems, of understanding how people are receiving this and what we can do in the future as well. So with that, I'll open the floor up to questions, and Sandy and I will be here to answer that.
Awesome. Thank you all so much. This has been a really great presentation. I do have a quick question as people, drop their questions and comments in the chat. So I thought it was interesting that you all are using a LinkedIn group. And so can you maybe just talk a little bit about the decision behind starting a LinkedIn group, and then what sort of is that? Because I think most of us are familiar with sort of like a personal LinkedIn page or maybe like a business page, but what is the group and how is that different than maybe some of the other LinkedIn interfaces?
Yeah, that's a really good question, and something that we went back and forth multiple times. So initially we had a discussion forum that was on the website, and we did a lot of testing with that, even once it was sort of up and running on the website. And the feedback was people didn't want to have another login to be able to access that. And so we had put that in place for security measures, because people were concerned about their information getting mined for different things. And also people didn't want anyone else kind of just looking at the conversation. So initially we had 6 different discussion forums for different purposes. So we had one that had everyone in it, one that was specific to consumers, clinicians and researchers, and people found that really overwhelming. And so we played around with the idea of having a group on a public platform. And we recognized that Facebook probably was not, I guess, people use Facebook for more personal matters, whereas LinkedIn was a more professional platform that researchers were already on there, clinicians were there, as well as high level consumers that are quite involved in their advocacy work. And so we thought that would be a really good starting point to test the waters out on how the discussion forum would work. And we have kept it an open group because we recognize that it's important for the inclusivity as well, which will also change the dynamics of the conversation. So we do recognize that. And also, I guess the biggest thing is understanding that this is a national or international connection opportunity, that there is definitely more scope for state-specific and local communities of practice or opportunities for people to connect as well. So this is just an overarching national effort, and that there needs to be that supporting contribution from the different states to run those networks as well.
Awesome. And, I really like the idea of a LinkedIn group. So I definitely think I'm going to check that out too, because it sounds really promising.
Great. Thank you.